Right, so we've been looking at a growth factor that's involved in hematopoiesis and how it responds to chemotherapy. So when a patient has induction chemotherapy, the level of this growth factor, which is Flt3 ligand, increases to 100-fold above the normal level if they're going into a remission. And if they're not responding to chemotherapy, then you find that the growth factor level remains suppressed. So this is a blood test that can be done very simply, and what we're hoping is that this might be able to replace or at least complement examination of the bone marrow, which is an invasive test. So we recently published a paper on this in collaboration with Mark Levis from Baltimore, Johns Hopkins. We looked at some data from the AML 15 and AML 17 studies, and it looks like when you even just measure this growth factor at a single time point, you can predict who is going to do well and have a long remission after chemotherapy, and you can also identify people that are not responding very well. So this is a retrospective study. I think the next step would be hopefully to be able to monitor Flt3 ligand in an NCRI AML study and to really evaluate how useful it might be to looking after patients.